Welcome. Have you ever experienced tingling, numbness, or burning pain in your hands and feet? It could be a sign of peripheral neuropathy, a condition affecting millions worldwide. In this video, we'll explore what peripheral neuropathy is, its causes, symptoms, and how it's managed. Peripheral neuropathy isn't a disease itself, but rather a result of damage to the peripheral nerves. These nerves are the communication lines that transmit information between your brain and spinal cord and the rest of your body. The causes of this nerve damage are varied. Diabetes is the leading cause, where high blood sugar levels over time can injure nerve fibers. Other causes include autoimmune diseases like lupus and rheumatoid arthritis, infections such as Lyme disease and shingles, inherited disorders, exposure to toxins like heavy metals or certain medications, injuries that compress or damage nerves, vitamin deficiencies, particularly B vitamins, and even kidney disease. Sometimes the cause remains unknown. This is referred to as idiopathic neuropathy. Now, let's delve into what actually happens to the nerves. In peripheral neuropathy, the myelin sheath, which is the protective covering around the nerve fibers, can be damaged or destroyed. This disrupts the nerve's ability to transmit signals effectively. Alternatively, the nerve fiber itself, called the axon, can be damaged, leading to a similar communication breakdown. This damage can affect sensory nerves, causing pain, numbness, and tingling, motor nerves, leading to muscle weakness and coordination problems, or autonomic nerves, which control involuntary functions like blood pressure, heart rate, digestion, and bladder control. The specific symptoms a person experiences depend on which type of nerve is affected. Peripheral neuropathy is surprisingly common. Estimates suggest that it affects around 2.4% of the general population, but this number increases significantly with age. Individuals with diabetes are at a particularly higher risk, with some studies indicating that up to 50% of people with diabetes will develop peripheral neuropathy at some point in their lives. Other risk factors include a family history of neuropathy, alcohol abuse, exposure to toxins, and certain medical conditions. The signs and symptoms of peripheral neuropathy can vary widely depending on the nerves affected and the severity of the damage. Common symptoms include gradual onset of numbness, tingling, or prickling in the feet or hands, which can spread upwards into the legs and arms. Sharp, throbbing, freezing, or burning pain is also frequently reported. Increased sensitivity to touch, even light touch, can make daily activities uncomfortable. Muscle weakness, loss of coordination, and difficulty walking are common when motor nerves are involved. Autonomic nerve damage can lead to heat intolerance, excessive sweating or decreased sweating, bowel, bladder, or digestive problems, and changes in blood pressure, causing dizziness or lightheadedness. Diagnosing peripheral neuropathy involves a thorough medical history, physical examination, and neurological assessment. The doctor will ask about your symptoms, medical history, and any potential risk factors. A neurological exam assesses your reflexes, muscle strength, sensation, and coordination. Further testing may include nerve conduction studies, which measure the electrical activity of your nerves, electromyography, or EMG, which assesses muscle activity, blood tests to check for underlying conditions like diabetes, vitamin deficiencies, or autoimmune diseases, and, in some cases, a nerve biopsy to examine a small sample of nerve tissue under a microscope. Peripheral neuropathy can be classified based on the type of nerve affected, the cause, or the pattern of nerve damage. For instance, it can be categorized as sensory motor or autonomic neuropathy, depending on which nerves are primarily involved. Based on the pattern, it can be classified as mononeuropathy, affecting a single nerve, or polyneuropathy, affecting multiple nerves throughout the body. Understanding the specific type of neuropathy is crucial for determining the best course of treatment. While there's no cure for peripheral neuropathy in many cases, various treatments can help manage the symptoms and improve quality of life. Treatment focuses on addressing the underlying cause if identified. For example, controlling blood sugar levels in diabetic neuropathy is crucial. Medications can help manage pain, including over-the-counter pain relievers, prescription pain medications, and anticonvulsants that can also alleviate nerve pain. Physical therapy can improve muscle strength and coordination. Assistive devices, such as braces or walkers, can help with mobility. For autonomic neuropathy, medications may be prescribed to manage blood pressure, bladder control, or digestive issues. Lifestyle modifications, such as regular exercise, a healthy diet, and avoiding smoking and excessive alcohol consumption, can also contribute to better overall health and nerve function. Preventing peripheral neuropathy often involves managing risk factors and adopting healthy habits. For individuals with diabetes, maintaining strict blood sugar control is paramount. Avoiding excessive alcohol consumption and smoking can protect nerve health. Ensuring a balanced diet rich in vitamins, especially B vitamins, is essential. Protecting yourself from toxins and repetitive motions or prolonged pressure on nerves can also help prevent nerve damage. Addressing underlying medical conditions promptly can also minimize the risk of developing peripheral neuropathy. The prognosis for peripheral neuropathy varies depending on the underlying cause, the severity of nerve damage, and the individual's overall health. In some cases, if the underlying cause is treated successfully, nerve damage can be reversed and symptoms may improve. In other cases, peripheral neuropathy may be a chronic condition requiring ongoing management. Research is continually exploring new treatments and therapies for peripheral neuropathy. This includes studies investigating new medications, nerve regeneration techniques, and advanced pain management strategies. With proper diagnosis, treatment, and lifestyle modifications, many individuals with peripheral neuropathy can effectively manage their symptoms and maintain a good quality of life. If you suspect you have peripheral neuropathy, it's essential to consult with a healthcare professional for a proper diagnosis and personalized treatment plan.